Hi everyone, I'm Namita Sudhir, a third year internal medicine resident at Texas Health Presbyterian Dallas Internal Medicine Residency Program. I'm presenting my presentation today, and the title of the presentation is COVID-19 Infection Triggered Microscopic Collagenous Enterocolitis. Microscopic colitis is an inflammatory condition of the colon that causes chronic watery diarrhea. The etiology of microscopic colitis is not fully understood, but the pathogenesis is likely multifactorial, involving key components of immune dysregulation and environmental exposure in susceptible individuals. Reported risk factors include nonsteroidal anti-inflammatory drugs, proton pump inhibitors, and smoking. The involvement of gastrointestinal system in COVID-19 infection is well established. Persistent diarrhea after COVID-19 infection has been seen in many patients. There have been rare case reports of association between COVID-19 infection and microscopic colitis, both the lymphocytic and the collagenous subtypes. Collagenous enteritis, where collagen deposits are also found throughout the small intestine, has been rarely described in the literature, but no association with COVID-19 has been reported. We present a case of a 42-year-old female who developed new onset collagenous enterocolitis following COVID-19 infection. Moving into the case description, a 42-year-old female with history of smoking presented with persistent watery, non-bloody diarrhea since the diagnosis of COVID-19 infection approximately 6 months prior to presentation. She did not have any gastrointestinal symptoms and was not on any culprit medications prior to the COVID-19 diagnosis. Initial workup, including thyroid stimulating hormone, stool polymerase chain reaction panel for infections, stool culture, was negative. A computer tomography scan of the abdomen and pelvis with contrast demonstrated pancolitis. Upper endoscopy and colonoscopy were performed, which revealed normal gastric and duodenal mucosa, superficial ulcer along the colonic mucosa, and friable mucosa with spontaneous oozing noted on withdrawal of the probe along the ascending transverse and proximal descending colon. Random biopsies were obtained, which showed normal gastric and duodenal mucosa, no evidence of celiac disease, and irregularly thickened subepithelial collagen layer along the mucosa of the duodenum and ileum, and markedly thickened subepithelial collagen layer in the colonic mucosa, consistent with collagenous colitis and enteritis. The patient was started on oral budesonide, which showed significant improvement in the frequency of her diarrhea. Here, we can see the histologic views of the ileal biopsy on the left and the colon biopsy on the right, demonstrating the thick bands of the subepithelial collagen in collagenous enteritis and colitis, respectively. These are the colonoscopy views of the terminal ileum. That's the first one. The second, the ascending colon. The third, the transverse colon. And the fourth, the hepatic flexure, which demonstrates the superficial mucosal ulcers along the mucosa. Infection with COVID-19 has been suggested as an inciting event for microscopic colitis, including both the lymphocytic and the collagenous subtypes. Studies have indicated that collagenous mucosal inflammatory disease is a more extensive pathologic process, and histologic changes may not be simply localized in the colon but may be a far more extensive process. However, during literature review, we did not find any association between COVID-19 infection and collagenous enteritis. The dysregulation in the immune system known to occur in COVID-19 infection could be a potential explanation for the development or unmasking of microscopic colitis. Our patient did have a history of smoking that put her at increased risk for developing microscopic colitis, but notably, she did not have any symptoms prior to the diagnosis of COVID-19 infection. We hope to bring more awareness to this potential association between collagenous colitis and enteritis with COVID-19 infection, especially in the context of a diagnostic evaluation for patients presenting with chronic diarrhea following a COVID-19 infection. Thank you.